a growing awareness among healthcare professionals to shift the emphasis of current medical practice from dealing with diseases at their symptomatic stages, where they're often far advanced and even irreversible, to an emphasis of identifying and dealing with disease long before symptoms appear, when treatment is likely to be more effective and far less costly, producing longer and healthier lives. Diseases such as arteriosclerosis, the cause of heart attacks and strokes, as well as breast and lung cancer, emphysema, osteoporosis, diabetes, and degenerative diseases, often appear without warning, producing catastrophic results or sudden death. And yet, as we will see, they are often preventable, stoppable, or reversible.
Let's look at the benefits of HealthView. First, early detection, catching disease in its early stages. Second, motivation to make the necessary lifestyle modifications. Third, empowerment, giving you the knowledge and the tools to control your own health. Fourth, tracking to guide and reinforce your efforts. The HealthView exam is a technically advanced three-dimensional look into your anatomy that goes far beyond conventional screening tests in detecting early disease. It shows in great detail the heart, lungs, bones, and breasts. HealthView also provides women detailed information about the breast that can augment a regular mammogram, adding important diagnostic value. The exam is completely non-invasive, painless, virtually risk-free, and takes less than 10 minutes. The technology that drives HealthView is a revolutionary new technology we call AngioCat, with high-speed computers and proprietary software creating and analyzing 3- and 4-dimensional images of the body. Let's follow Rita and Walt through a typical HealthView examination. Rita will lay on the CT table, and the technician will ask her to hold her breath for a few seconds. In less than 10 minutes, the exam will be complete. Following your exam, you will be taken on a computer graphic journey through your own body. The motivation needed to guide you into staying healthy or change your lifestyle can occur with this experience of self-visualization. We begin looking at the lungs, which are made of blood vessels and air passageways. Tissue damage from smoking or secondary smoke begins in the small passageways, eventually leading to further tissue destruction and emphysema. A chest X-ray, which is two-dimensional, shows very little of this anatomy or the presence of cancers. The cancer has to be relatively large and in the late stages before they are able to be seen. With HealthView, we can see this anatomy in greater detail, from the largest structures down to the lung tissue level. We can roam through the chest cavity with a slice that is less than 1 millimeter thick, taking apart the anatomy layer by layer. We see into lung tissue where respiratory air structures are seen as tiny black holes. Then we go on to look inside the bronchial airways, where most primary lung cancers begin. We do what we call virtual bronchoscopy without touching the patient. We can look down and pass through the bronchial tree in the computer to look for early, curable tumor development. Walt had a normal chest X-ray and pulmonary function study. While normal lung tissue is seen throughout most of his lungs, we see areas of early tissue destruction and finally, larger areas of complete destruction. This is emphysema and is a result of his smoking. After we look at Rita's lungs, we will then take a look at her breasts. Mammography also has been the gold standard for breast cancer screening, but has a misdiagnosis rate of 12 to 20%. Because it is like the chest X-ray, it tends to not see the detail, especially in viewing larger and denser breasts, or with implants. With HealthView, the breasts are examined layer by layer without touching, undressing, or the use of uncomfortable breast compression. Rita's breast exam was normal, but here is an example of a 1-inch tumor found with HealthView, missed on 8 consecutive annual mammograms. HealthView also analyzes the skeleton for osteoporosis. Next, we look at the heart and focus on the coronary arteries. Blockage of these arteries is a cause of heart attacks or myocardial infarction, which means death of a heart muscle. This remains our most prevalent, most costly, and most lethal national health care problem for both men and women. The death rate from heart attacks in women is 6 times that of breast cancer, and the disease has the same prevalence as in men. Let's discuss risk factors, as they are commonly used to assess your individual risk for a cardiac event. But there are often misconceptions about what these risk factors tell us. Many people consider high cholesterol to be a death sentence. In fact, most people with high cholesterol don't get heart attacks. You may have very high cholesterol levels and be free of this disease. Conversely, most heart attacks occur in people with normal range cholesterol levels of 180 to 220. So normal cholesterol levels do not rule out heart disease. Cholesterol levels relate to plaque growth and are important to track for this reason. Bringing cholesterol below 170 correlates with slowing or stopping the plaque progression. Smoking doesn't cause plaques to form, but is a deadly combination accelerating clot formation. Genetics are vitally important, but it is a complex series of genetic interactions that determine the presence or absence of heart disease. Your family history doesn't necessarily tell you where your health future stands as an individual. With HealthView, we are going to look directly inside your coronary arteries for plaque structure, and particularly calcium, to determine the relative presence or absence of heart disease and your risk for a cardiac event. We do this not to predict future problems, but to determine your individual need to be enrolled in programs that can prevent cardiac events and even reverse the disease before complications can occur. To understand the importance of HealthView, one must first appreciate the current problems we have in dealing with this #1 national health problem.
Until now, there did not exist a detection system for early disease identification short of doing a heart catheterization, and even that procedure can be very misleading. All of our current standard tests will only become abnormal when blood flow is impaired. Blood flow is not impaired until there is at least a 60 to 70% blockage in the coronary artery, when the disease has already reached an advanced stage. HealthView can detect disease with as little as 10% blockage at a much earlier stage when this disease is easier to treat.
What makes identifying heart disease early so very important is that it is stoppable and even potentially reversible. Over 4,000 people each day have heart attacks in this country, and 1/3 of them die from those attacks. 46% of men and 63% of women had no prior symptoms or warning signs.
The explanation for this has recently become apparent and changes the whole approach to this disease. It was formerly thought that a patient did not have significant disease unless there was some blood flow impairment, that plaques would grow progressively to first partially shut off blood flow, causing symptoms, and finally completely block the vessel. However, recent studies from major cardiac centers around the country have consistently shown that about 85% of heart attacks are caused by plaques that have not yet reached this 60 to 70% blockage level necessary to impair blood flow. The risks of heart attack begin well before detection occurs by current screening methods. This also explains why bypass surgery and catheter angioplasty have not been shown to extend life except in a few select circumstances. While these invasive procedures can be life-saving, they are only the band-aids, bypassing flow obstructions and relieving symptoms. However, they don't deal with the many smaller plaques that may be equally lethal. These are dealt with in plaque regression therapy programs.
HealthView can identify virtually all people at risk and enroll them in programs designed to prevent such catastrophes as sudden death. Rita's heart is seen from above a moving tissue plane. At this level, we see the aorta and pulmonary arteries. As the plane moves, we come down to the left coronary artery emerging from the aorta, and at this point see calcified plaque in the left anterior descending artery. A little further down this vessel, we see larger plaque that puts her at risk for a cardiac event that she would have had no other way of knowing. Another benefit of HealthView is to guide women approaching menopause and beyond in hormonal replacement therapy planning. The presence or absence of heart disease will dominate decisions about usage of estrogen and progesterone.
The primary treatment of coronary artery disease, as well as other problems we've mentioned, are medical programs that can stop and even reverse disease. For example, plaque regression therapy relies primarily upon immune system building, including select programs in nutrition, exercise, and behavioral modification and stress management, guided by leading authorities in these fields.
Perhaps the most serious problem we have in the management of heart disease is that no non-invasive direct tracking system ever existed before. For the first time, HealthView provides such a tracking system to non-invasively guide you and your physician in managing your health program at any stage. Together, you will work in partnership with our staff at HealthView and your own doctor to decide the right course of action tailored specifically to your individual needs. With HealthView, you have made a commitment to being an active participant in your overall health and well-being.